Borderline personality disorder is often misunderstood, misdiagnosed, and can just be confusing. And today I want to share with you one crucial element that is often overlooked in the diagnosis of borderline personality disorder. All right, so if you haven't been here before, my name is Matt. I'm a therapist at Progress Therapy, a small group practice providing virtual care to people dealing with ADHD, executive function problems, anxiety, and others. And we're just going to jump right into it. There are two problems that I see in my practice. And the first is when people are diagnosed instantaneously. So they go to see a provider for the very first time and they leave with a diagnosis of borderline personality disorder. This is a major problem and a major red flag. The second issue I see is when people present with clear symptoms of borderline personality disorder and then the conversation about that disorder is never had. This is another issue, another red flag. So these two issues right here, being diagnosed instantaneously or never hearing about the diagnosis and never even having the discussion, causes a lot of problems. And one of the major problems it causes is confusion. And in addition to being confusing, it might also prevent someone from hearing or learning about an intervention that could potentially be very helpful for them. And we're going to dive into these two problems in depth in just a moment. But the good news is that these two problems can be avoided very easily. And that's why I want to make this video and talk about this. So then how is it that we prevent this problem? And it comes down to one crucial element that is often overlooked. And this is timing. That's right, timing. This has to be considered when thinking about the diagnosis of borderline personality disorder. Another factor that's crucial in the diagnosis of borderline personality disorder is doing a thorough assessment over a period of time. At the end of the day, we're talking about time. Time has to be considered. Let's dive into that now. Let's start with the issue of being diagnosed immediately. This should never happen. If you meet a provider for the very first time, you should not be diagnosed with BPD definitively. And you're going to hear me use BPD. It's much easier to say that than borderline personality disorder. So BPD from here on out. You should never walk out of your very first meeting with a new provider with a diagnosis of BPD. But then if someone presents with clear symptoms of borderline personality disorder on your very first visit, then why shouldn't they get the diagnosis? Well, here's why. For some people, they go through particularly stressful seasons in their life. Maybe they lose a loved one, maybe they lose their job, perhaps they've gone through a traumatic event or they were in an accident. I mean, there's all sorts of things that can make life stressful, right? So let's say someone's going through a particularly stressful season of their life. It can happen that when people are going through a stressful season in their life, they begin presenting with symptoms that look really similar to the symptoms in BPD. And now I recently made a video about BPD and I went through the criteria that's on the Mayo Clinic website. If you want to check that out, I'll link it right here. So let's just give a hypothetical example. Let's say someone lost their job, right? Unexpectedly lost their job. They now have no income and no way of supporting themselves. This person might describe feelings of emptiness. They might be describing feelings of fear of abandonment. And maybe even they're describing mood swings. Now, these are issues and symptoms that are also found in BPD, right? So if this person comes into a provider's office and begins describing these symptoms in the context of losing their job, we have to consider time and the event and the context as a factor. It is possible that this person is presenting with these symptoms because they're going through a stressful event. This does not mean it is BPD. However, only time and a thorough assessment will tell, right? And so this is one reason why we can never diagnose BPD on the very first visit. It could be that these symptoms are related to a stressful season or a stressful event going on in a person's life. So now you can see how confusing it would be if someone came in and described these symptoms in the context of losing their job and immediately are told that they have BPD. This might not be the case. And then they might leave the office thinking that they have BPD. And then this just causes a lot of confusion. As providers and even as recipients of mental health care, we need to be aware that time and context are crucial, right? And so how do we avoid this problem? Well, we can allow for the passage of time when we're making our assessment. We can consider the context in which the person is experiencing these symptoms. Again, this all has to be factored into the consideration of the diagnosis of BPD. It's crucial. Now let's talk about the second issue where someone presents with clear symptoms of BPD over a long period of time. However, a discussion is never had. This can be just as problematic as the first issue we just went through. Now, I do want to be clear that I know the DSM has its own issues and that diagnoses in general are not always the right approach. It can be very limiting, and there's just a lot of issues with diagnosis and DSM and all that. I totally understand. At the very least, some of the diagnoses can provide a helpful framework that gives us some direction in deciding which treatment might be helpful. So for example, if someone meets the criteria for BPD, we know that DBT could potentially be extremely helpful. Now that's just an example. Now I know one thing about BPD is that there's a lot of misunderstanding, there's stigmas, there's all sorts of confusion around this diagnosis, and this actually prevents providers from talking about it with clients. However, as mental health providers, we do have to do our due diligence to at least discuss what we are observing with a client. And this includes discussing BPD. We cannot shy away from it. Now, we can always be forthcoming about our thoughts about the DSM or our issues with it. At the same time, if someone is presenting with symptoms of BPD that are clear over a long period of time and we don't talk about it, that's not helping anyone. So in my experience, when I've worked with people who have presented over a long period of time with symptoms that are very clearly related to BPD, I'll have that discussion with them. Now, I'm not saying we diagnose, but we at least have that discussion. And many times, people feel relieved. They begin sharing that the symptoms we're talking about, the symptoms related to BPD, are ones that they can relate to. And sometimes they say, I've never heard about this before. I never knew this. I thought it was just me. And so in many ways, at least opening that door to discussing it, to presenting the symptoms and talking about what it is, can really help someone gain some clarity into what they're struggling with. Additionally, it also opens up new avenues for treatment. So if someone doesn't talk about BPD with someone, the conversation about DBT, which is a non-medication-based, skill-based treatment, might never be spoken about. However, DBT is extremely helpful for BPD. So as you can see, if we don't have this conversation with people, and again, we're not diagnosing, but if we don't have the conversation, we might increase confusion for someone where they could otherwise experience some clarity, and we might not talk about treatments that could be really helpful for them. And these are just two of the issues that we see. Timing, time, conducting thorough assessments over a period of time. We do need to consider time as a factor in the diagnosis of BPD. Oh yes, and I forgot to mention this in the beginning. This video is for educational purposes only. This does not constitute clinical or legal advice. Anyway, we hope this video was helpful for you. We hope you learned something, and we look forward to seeing you soon.